Hi everyone, Amanda here from Little Lotus Yoga, and the other day we chatted about our pelvic floor, where our pelvic floor is, different signs and symptoms you may be having as a woman, whether you are pregnant, recently giving birth, or years and years postpartum. Maybe also if you're experiencing menopause, you might be experiencing some of those signs and symptoms. So we dove in to different things we may be experiencing in our life and how we can tap into the amazing resource of pelvic floor physiotherapists to really help understand what is our baseline of health. Do we have any issues that we need to be addressing? And if so, how are we able to move through them to create more optimal health and wellness in our life? Today, I wanted to chat and dive a little bit deeper into what exactly is our core. So a lot of times when we hear the word core, people think, oh, that's my six-pack abdominals. Those are the abdominals I see, when I'm standing at the grocery store and I see that Sports Illustrated magazine, or when I'm watching a movie and I see someone who's really fit in their swimsuit on the beach. Our core system is actually multifaceted, and what our core system consists of is 4 different parts. So the first part of our core is our pelvic floor. So like I mentioned the other day, and if you haven't had a chance to watch that video, pop over and take a peek at it. But our pelvic floor rests in our pelvis, sort of like a sling or a hammock, and it helps support our internal organs. The second part of our core is our diaphragm, and our diaphragm moves as we breathe. So as you're sitting here right now watching this video with me, every time you breathe in, your lungs fill with air, your diaphragm is moving down in your body, and as you exhale and the air leaves your lungs, your diaphragm is coming back up to resting. The third part of our core is our transverse abdominals. Our transverse abdominals are actually the deepest abdominal muscles we have within our body, and they wrap around through the front of our body deep inside. Our transverse abdominals are the abdominal muscles we feel if you've ever been really, really sick, if you have vomited a lot, or if you have a really bad cough and you're coughing and your abdominal muscles are hurting or straining. That usually is our transverse abdominals being overworked. And so that's the third part of our core system. The fourth part of our core system is our multifidus. And these are muscles that run down through either side of our spine. So again, the 4 parts of our core system, we have our pelvic floor on the bottom, we have our diaphragm on the top, right underneath our lungs. We have our transverse abdominals that wraps around the front of our body, and we have our multifidus, those muscles that run down through our spine. When our core system is working optimally, all 4 of those parts are working synergistically, which means they're working together in a really great pattern and mechanical functional movement. If any one of those 4 parts of our core system isn't firing optimally, if it is injured, if it has been through trauma, if there's any sort of tweak that's off, it's going to have an effect on our whole system. So it's really important when we are showing signs and symptoms or things that are coming up in our life and we're thinking, maybe that's my core being a little bit off or something's happening, that we're looking at, okay, what part of the system is maybe working too hard or not hard enough? And how can we have the whole system work synergistically, working together? Think of our core system like a canister or a piston, and how it's going to work is it's going to work together. So we have our diaphragm here at the top. Remember, those are just underneath my lungs. We have the diaphragm and we have our pelvic floor here. Every time we breathe, so right now with me, take a deep inhale. Every time we inhale, our lungs fill up and our diaphragm lowers. As our diaphragm lowers with our lungs filling up, our pelvic floor is going to lower and release and relax. As we exhale, our diaphragm comes back up to resting, and our pelvic floor, if it's working functionally, without even thinking, our pelvic floor engages and gently lifts. So we inhale, diaphragm lowers, pelvic floor relaxes. And as we exhale, diaphragm comes back to resting, pelvic floor gently engages and lifts. Now, usually before pregnancy, before baby, our core system just knows how to work. It's firing like this all the time. So every time we breathe, diaphragm lowers, pelvic floor relaxes. As we exhale, diaphragm comes back to resting, pelvic floor engages and lifts. So that piston or that canister system is always working synergistically together. Then we get pregnant. And what happens when we get pregnant? We have a lovely baby that we are growing. We are growing another human being, or maybe two, or maybe three. And so as that baby grows, our body needs to adjust and move in order to make room and to accommodate baby. As our internal organs shift and move a little bit, we also begin to have pressure within the body from having that lovely human being we're growing. And those various things like our posture, pressure within our body, the movement and readjusting of internal organs, those are all different things that can have an effect on how our core system, whether it's synergistically working together or not. And so it's really common during pregnancy that our core system goes through a lot of changes and starts to say, you know, I'm not really working together, or maybe today I'm not going to be friends with all the other parts of my core. I want to do my own thing. And then we have babies. So, you know, whether you have a cesarean birth or vaginal birth, there's different, different ways that's going to possibly have an impact on our core health and wellness. And then we move to the postpartum stage. And during the postpartum stage, our body then has to start to readjust again, because we're no longer carrying this sweet little baby inside us, but we have that sweet little baby that we are carrying all the time and snuggling and loving and picking up and, you know, holding and feeding. And so our core system has gone through pregnancy, has gone through birth, and says, hey, wait a minute. I need some nurturing and love too. I need some help to figure out what is this new life for me as your core. Hey, can you help me to understand how I can work again in that synergistic system? So sometimes that's where we start to see those signs and symptoms of leakage, of stress incontinence, urge to urinate or for bowel movements, back pain, pelvic pain, discomfort with sexual intercourse. Those are some different signs and symptoms we may be feeling if things within our core system are not working together and as optimally as they could be and as optimally as they would like to be. So I really, really urge you, whether you are pregnant, whether you have recently had a baby or had a baby years ago, take some time to check in with you inside your body and figure out, you know, how do I feel? Am I seeing any of these signs and symptoms in my life? And how can I up-level my health and wellness to be the best version of me with the best core system that wants to work together all of the time in order to have a healthy and well life. Like always, if you have questions, please feel free to pop them in the comments, send us a message. We would love to connect with you.